Thank you for staying with us. We do apologize for that technical hitch earlier on. We go now to our first topic of the day, and we'll be looking at the outbreak of Lassa fever in Nigeria.
Now, last Tuesday, the Nigeria Center for Disease Control declared there was an outbreak following the increase in the number of Lassa fever cases reported in states since the beginning of the year. Today, we are talking about the awareness, treatment and vaccines, if there are. Joining us to speak on that issue is Emmanuel Matthews, a medical practitioner. Good evening.
Good evening.
Now, help us demystify what Lassa fever is all about, because at the end of the day, if we're supposed to educate, we're supposed to play a more preventive role this time around. What is Lassa fever exactly?
Lassa fever is simply like any fever. You've got to go back, keeping it simple, is an attack of the immune system that creates excessive vomiting, diarrhea, and all of that in itself leads, like any fever, creates, loss of fluid in the body and a whole range of other activities in the body that leads to eventual death, because the person doesn't have enough fluid in the system, losing blood, coughing, and all the diarrhea and all that gets dehydrated quite quickly and then ultimately passing away. In itself, like any fever, like cholera, like any other fever, could be managed. One of the problems here in Nigeria is how we stop, manage repetition of major outbreaks like this in Nigeria, and what we should be doing as a country, as a nation, to educate.
Okay, we'll definitely get to that, but we're still demystifying this issue, Lassa fever, and the fact that we have a disease outbreak already declared by the NCDC. How can anyone come down with Lassa fever as it is? What are the things that can predispose someone to the fever?
It's not directly contagious, but once you are exposed to an environment where, there's been an... Go back, Lassa fever in itself is carried by rats or rodents of various species. And this through, their bodily fluids transferring onto human foods, and then into the human body system, and then infections start affecting our own immune system and creating other things. How can we prevent this is the main thing. However, if you look at the states where this Lassa fever originates, where you have regular outbreak of this fever, you begin to see the demographics and the condition prevalent that leads to this. And those are the issues that I think primary healthcare providers across the nation, most of the states, should be looking at the preventative.
Well, talking about those states, we are looking at Edo, Ondo, Ebonyi, FCT, Nasarawa, Taraba, Plateau, and Bauchi states.
Yeah. Now, if you look at those states and look at regions within the states where these things happen, you look at it predominantly low income area, poor, highly populated or densely populated areas where foodstuff and human beings, animals and human beings cohabitate in an environment that in itself is not clean, and a whole range of other human factors. Some live next door to heaps and heaps of dunks and things like, and the water system within the community is the same water that they use to cook, bath, defecate in, and do other...
But these are not necessarily rural areas, so they are not as congested as you're painting the picture, seemingly, isn't it?
If you look at sanitation. If you go back to the outbreak of Ebola in countries like Sierra Leone, Congo, and all of that, just digressing a little bit, and look at the hotspots, where do these things come from? Then you begin to trace by healthcare in itself. You have to go back to your lifestyle. You have to go back to an environment that creates
the condition that predisposes.
They expose you to it, and if you can start dealing with those environment, those issues, then you begin to prevent outbreak of any.
Okay, if I get you correctly, you're saying that poor sanitation is also encouraging the spread of Lassa fever
Absolutely.
across Nigeria.
Poor
But
food
now-
handling, poor sanitation, poor living condition as well. People live with their animals and in the same, environment. And
Okay, I wanted to add to that. Now that we know that that's really something that is our reality in Nigeria, in all of the states, should every Nigerian be worried? Because we know that people are constantly moving around. Someone in Plateau State is in Lagos tomorrow. So should everybody be worried about Lassa fever?
Yes, we should be. Like any outbreak of any infectious diseases, we should be worried and take preventive measures. In primary health care, you have to promote cleanliness, hygiene, water handling, for example. Most of these societies and communities that you have this, and for example, most people, somebody can be infected in, say, Benue today in 4 hours, 6 hours is in the south, and it's traveled in a bus that is poorly ventilated,
Has had bodily contact.
packed to the brim all the way from Benue State, coming all the way down to the south and having exchange, bodily fluid with some people, and thereby transferring it. And they might even be coming with goods, with food products that are already infected.
Okay, now let's talk about arresting this, because we know that if we don't even know what's wrong with anybody, we can't start treating, managing, or preventing. Now, if somebody comes down with Lassa fever, isn't it possible, because earlier you said that it is just like every other fever. We know that malaria, by default, everybody thinks once you have fever, it's malaria. So how do we then tell the divide between Lassa fever and other fevers?
And because the reactions in the incubation period is slightly longer, and the outward reaction is faster. The degenerative reaction is faster than all the other fevers. Like you can have malaria and you can shake it off in no time if you're immune. If you're not immune, it's a different thing. It can go to stage 1, stage 2, stage 3 until it affects the whole body. Malaria in itself is a deadly disease. Because in Nigeria or in African tropical regions, we're used to it. So it's like we have coping mechanism, just like other fevers that you will have, like Lassa fever. Some people that have good immune system that can keep it down, not necessarily can slow it down, not stop it. And that's where, primary health care support comes in at the right level of intervention. And here in Nigeria, one of the challenges we have is early identification, early intervention to slow it, stop it, and treat it. It's treatable quite well. It should not kill. But because before it gets into, the advanced stages, because we don't have those
Now,
support.
let's quickly go back to some statistics from 2018. Now, we had a total of about 3,498 suspected cases and over 171 deaths and 633 confirmed positive. Now, if we have most prevalent centers as Edo, Ondo, and Ebonyi states, what's your stand saying that we have to have rapid diagnostic tests done at every instance we suspect there is malaria?
Absolutely. I see one thing in Nigeria that we need to do, including the Center for Disease Control, is we know where these things have happened in the past. So there should be control measures put in place for interventions and rapid testing or assessment areas put in place, and basically quarantine facilities as well, in order to curb it, slow it down, and avoid it from spreading.
Now, what is the NCDC doing this time around? Because if it is declared an outbreak, then it means that they have the emergency operation centers intact. But now in Ondo State, now we have over 50 cases. Residents are scared, doctors are scared. It's a situation that they can't seemingly manage or control, and they're calling it a state of emergency. Who do we now blame? How do we manage this situation? And one of the fears as well is that you look at the lines, the border lines between Edo, Ondo State, there's also the fear it might cross over to Ekiti and other surrounding states as well. The concentration. How do we then move forward with this and then restore calm? Because at the end of the day, people are losing their lives. 50 lost in Ondo State.
In Ondo State from now and counting. Those are the 50 that you know that are reported cases or recorded cases. What about those that you don't know? Somewhere down far in the woods that you just felt like, you know.
So what should we be doing now? Because they say they don't even have spaces enough, bed centers enough for people who are put into isolation.
And that's where the government come in. That's where the states come in. That's where the Center for Disease Control comes in. And that's where the appropriate policy and funding comes in to manage. It's a crisis. You cannot manage crisis by wishing it away. You have to put fundamental structures in place and also funding behind it to ensure that you are arrested. Now, I can tell you this, and this is one of the problems we have in the healthcare system in Nigeria that's totally different from Europe, America, and the other developed world. We take healthcare as a social service, as a benefit for the underprivileged. And quite frankly, Lassa fever will affect the low-level income faster than it will affect the higher, you know, the well-to-do and all that. Why? Because of exposures and the living environment and conditions are different. But guess what? These people are also your drivers, your cook, your children, nurses, and all that. They are in your house every day.
Okay.
And that's a danger to every policymaker, every government official.
Emmanuel, yeah. I would just want to also have your response now when we are talking about how serious this case is. Still focusing on Ondo as our case study this evening. Now, some patients are said to have mysteriously escaped, which means that there's the potential of having their contacts with other individuals, and then they have the disease spread more. Now, if we don't have any vaccines and there are fears that even the drugs might lead to disability if you are not killed eventually, how do we go from there? And
it's all down to the work of the Center for Disease Control in terms of we have data already. It's done. This recent outbreak, 2017, 2018, and now, it's not. Lassa fever has been in the nation for long. It's just now more pronounced in the system. You know, we have data for this. It's how this is controlled. It's all about management of these outbreaks. It will happen. There's no way we can stop it from happening. What the system should do, what the government should do, is to minimize the impact on the community when it does happen. To limit it to where it's happened, contain it, and eradicate it. Take an example, Ebola, when it came to Nigeria through Lagos. The only reason why it didn't spread was because it's not because it didn't have capacity to spread. It was a timely, structured, calculated intervention to contain it, arrest it, and eliminate it. That's why Nigeria was spared. Not because we had all the vaccines, we had all the money to throw at curing Ebola, or we were smarter than Sierra Leone, Congo. That because there was timely intervention, concentrated effort to slow it down, stop it, and eradicate.
Now that we don't have that, do we have any awareness of the ticking time bomb we have in our hands?
And that's what the government should do. Health workers should do, and it's all about awareness. You don't have to wait. The first step in any curative, of medicine is the prevention. You have to educate people about it. Lifestyle has to change. Cultural values have to change.